Hello, my name's Mark Ellis. I'm the General Manager of the Nursing and Allied Health Rural Locum Scheme. I've been with the program for a year and a half now and really enjoy working for such a great program. My background is in project and project management with a number of federal departments such as Department of Defence, the Department of Human Services and the Australian Federal Police. NAHRLS is a federally funded program which provides locum support for up to 14 days into rural and remote communities. NAHRLS can provide locums for nurses, midwives and other eligible allied health professionals across Australia. NAHRLS provides locum relief for practitioners to take leave to either undertake continuing professional development or just recharge their batteries so they can get back to the communities that they support.
I'm here to care for you, that's my job. I'm going to just do it to the best of my ability. And so for the next 8 hours or whatever it is of the day, then that's all it's about. Just doing your very best for people.
I can just pick up the phone to NAHRLS now and say to the workers at the end of the phone, hey, it's me, this is what's going on, I need a physiotherapist. They understand our business.
That was one of the things that I reflected back to NAHRLS on completion of our locum period was the high quality that I had to select from in the first place.
NAHRLS have been really great. There hasn't been any muck up with the bookings or anything like that for the plane tickets, etc. You go there, that's all organised.
We will organise and cover all of the transportation and all of the accommodation for the locum. So what we do is
We aim to make the provision of locum support easy and cost effective to the clinics that they're going to. We make sure that all our locums have been credentialed appropriately and are the right fit for where they're going. We take away all the administrative burden from the clinic which requires a relief and organise all the travel, all the accommodation for the locum so that they can arrive and start working straight away. Our vision is to keep providing this crucial support into rural and remote Australia. Our main aim is always to allow health practitioners to take the leave that they require to either undertake their continuing professional development to meet the AHRLS standards or also, as I said earlier, to recharge their batteries so that they can continue providing the support. We have lots of health practitioners around Australia who just can't get away for leave, whether to undertake study or, once again, just to have a break. So you can get a self-contained apartment for them for that time. I think it'll make it more comfortable for them for that time.
Fantastic.
As long as it all fits within the budget for it and everything, and it is cost effective compared to... Lots of the traditional agencies have agency fees which are on top of the salaries which they charge. Being a federally funded program, all those agency type fees are actually covered by the Department of Health and Ageing through our funding agreement with them. One of the other challenges is also for sole practitioners. Sole practitioners find great difficulty in being able to get away for a break. They can't close their business down for while they're gone because they won't have a business to come back to. Also, particularly in the allied health sphere, trying to find a locum can be very expensive for them. Once again, with NAHRLS covering all those extra costs apart from salary, we're able to make it cost effective and easy for them to find a locum.
Right, so just from Apollo Bay? Okay, and you were looking for a physio. Alrighty, no problems. So are you aware of how NAHRLS works?
Hi, I'm Michael Davis. I'm a physiotherapist. I work with people that have disorders that are neurological or musculoskeletal or cardiopulmonary, and I'm involved in rehabilitating them to get them better again. I worked in both acute and country hospitals. I worked in both suburban and country private practices. I worked in geriatric hospitals, I worked in mental health. And after that, I taught for about 6 years at the School of Physiotherapy in Melbourne. And throughout the last 25 years, I've been employed in acute medicine in a suburban hospital in Melbourne. So Leslie, I'm going to put some heat onto your back. I'm going to use a special hot pack to help make you feel more comfortable in this position, to help you with your back pain. Well, I heard about NAHRLS in the very early days in July 2011. I was actually rung up out of the blue by a recruiting officer who offered me a position within NAHRLS. I was unable to take it at that time, but I was interested in joining, so I went to their website and found out more information about NAHRLS, found out what their goals were, found out the type of people that they were trying to recruit and what sort of processes were required in becoming attached to them. I wanted to go with NAHRLS because I was interested in working in the country. I was interested in helping out with the physiotherapists who are working out in the country because I realised it's a problem trying to recruit. I also wanted to get out and improve my skill set a little bit by getting back to the country, because I've been working so much in the city in the last 20-25 years that I wanted to get back out of the country and be able to use a much greater diversity of my skills to be able to work with patients with all sorts of different problems.
Christine, what did you want to talk to me about?
Okay, so Marie...
Our locums have said on many occasions that the experiences they get are amazing and invaluable. Also, all the placements that we do are short term, so that they get a good chance to experience rural and remote community without creating a major upheaval in their lives.
In the countries, you tend to be, I think, a lot more appreciated by the local communities who don't take their health systems as for granted as what people do in the cities. They're appreciative, I guess, that there's they have a physiotherapist in the first place. They're not just you know, they don't have to go long distances to consult people who might have special expertise that they can't access. So they're appreciative of being able to come in and see a physiotherapist rather than having to go up to Geelong or somewhere like that.
Hello, I'm Max Broadley from Otway Health and Community Services in Apollo Bay in the southwest of Victoria. I am the Manager of Community Services, so I oversee all the non-bed based services of the organisation. It's a multi-purpose service, so there's a primary healthcare team, a community care team, neighbourhood houses, childcare services, youth services, health promotion, opportunity shops and administration. We have 9 townships in our catchment. The catchment is a geographically mountainous area. It's in the Otway Ranges, so that presents its own sort of difficulties in servicing those communities. Apollo Bay is the largest township, so that's where we're based. It's a small population of about 1,000 permanent residents that swells during the summer periods. It's on the south coast of southwestern Victoria. It's historically been a port for fisheries, and also there was some forestry industry and farming. So there's a population of people that come from that history. There's also a population of sea changers that come. We have a larger proportion of 65 plus years, but there's also young families. Getting support is difficult. We're a few hours away from Melbourne, at least a good 2.5 hours, I would say. Our next regional centre is an hour's drive over a mountain range. That regional centre is only a small population of a few thousand as well. It's quite difficult getting locum support because it's difficult to get here. It's not an attractive option, and services are busy wherever you go. So if I needed to get locum support to cover annual leave or long service leave, there really isn't a great depth of practitioners that can give me that block of time. They either have their own private practices or they're working for other organisations that require them as well. We have a physiotherapy program here, and the physiotherapist was planning to take some long service leave. So a big chunk of time, a little bit stressed about how we would maintain the physiotherapy program, and I simply made a call to contact in the Department of Health, who recommended NAHRLS. I rang NAHRLS straight away, had a great conversation with one of the officers there, and we worked out a plan within a couple of phone calls and a couple of emails. It was very easy.
So it's NAHRLS. NAHRLS.
There was an approval process from the NAHRLS end and we had to apply, and that's via a web-based application. We put all our details in. That went to the board of NAHRLS for approval. We were eligible and it was approved. The dates were set and the physio was able to go on long service.
All our placements are different. We can have a locum who can be down in a beachside town 1 week and then in remote Northern Territory the next. So each placement that a locum does is something different and something new to them.
Well, I've had a previous position here at Apollo Bay, as well as at Lorne, which is further up the coast from here. I've been in Mount Barker in Western Australia, and I've been in Mount Isa in Queensland.
Is it possible that we can get the same practitioner as we've had in the past? That'd be great.
Working in Apollo Bay too, I work with in a very supportive environment here in Otway Health. I've got a terrific manager, Max, who's very proactive in promoting and utilising the facilities and services that this institution has available.
I just wanted to discuss a few options with you for the travel and accommodation for the position in Apollo Bay.
Yep.
Now, as you know, we've got
The attractive things about using NAHRLS are that it's an organisation, so they credential their employees and their practitioners. They do all of that work. The other really important thing to remember as well is that if I was to source a locum myself, if I had the ability to do that, the travel costs and the accommodation costs would become my liability. By using NAHRLS, because they're funded also, my obligation is to pay the hourly rate and the super of the practitioner, but all accommodation costs and travel costs and the back admin is all funded through NAHRLS. So it's a cost neutral exercise for us. So we get to allow our practitioners their annual leave and long service leave, and I get a replacement locum and it's cost neutral.
G'day, I'm Mark Leddy and I'm the practice manager at the Camperdown Clinic here in Camperdown. It's a small family run clinic and primarily most of our doctors that we utilise are under the registrar training program. Camperdown is situated in the Western Districts of Victoria and it's commonly known out here as the Lakes and Craters country. Primarily the area is based on dairy farming. Although locally people say anything north of the highway is only good for sheep and anything south of the highway is where all the dairy farmers should be. And literally that's about where the rain falls. Most of it falls south of the highway. The clinic is actually in a building that was supposedly built about 1910. The atmosphere within the clinic is quite surprising. I've only been working here 5 years, but one of the things that attracted me too when I came for my interview was how homely it felt. It gave you a sense of warmth, a sense of, well, this is a nice place to be. And then that was consolidated because I quite often would see patients waiting in the waiting room, and it was almost like it was a social event. Because we are in a rural environment and our closest larger town is literally 50 minutes away, being Warrnambool, the doctors and care for patients literally from cradle to grave. So our doctors have training in obstetrics, so we do deliveries in town, and we have the aged care facilities which our doctors look after and everything in between. The primary highest percentage, I suppose, for us would be 65 years of age and over is a high percentage of our patient throughput, or the ones that we see, and we've got quite a large number of 0 to the 12-year-olds coming through here as well. But we look after sports injuries, aged care, and obviously our acute patients. We don't have a reserve of nursing staff sitting waiting to come in and help you out. I mean, the hospital has their nursing numbers and they're all employed appropriately up there. So we try to be self-sufficient, if that's the correct terminology, so that we look after each other when somebody wants to go on leave or go away on a course. So one of the other nursing staff will pick up extra days to allow that to happen. But unfortunately, sometimes this doesn't work, and there are commitments outside the clinic that are stronger than inside, and we respect that. So that drove us down the road of looking for a locum, looking for the opportunity to employ a nurse, literally pull them off the shelf, have them hit the ground running, and then have them thank you very much, and then have our staff back to full numbers. The experience that from utilising NAHRLS, when I initially made the phone call to actually having the staff member on the ground, it flowed. It was very everything just went step after step, limited amount of paperwork that we needed to do, and the ability to be able to just jump on the phone and clarify things with the staff member at NAHRLS made the whole process, just from my perspective as a manager, very enjoyable, instead of, you know, oh no, here we go again, I've got to jump a number of hoops to get this person here.
We pride ourselves on making the provision of a locum as easy as possible for the health clinic that requires the support. The whole idea of NAHRLS is actually to fill a void, not create a more burdensome process for them. We take out all the difficulty of identifying the person. We recruit the people. We also credential them. Every locum that NAHRLS uses has been credentialed through our parent company, Aspen Medical's credentialing process. Every locum that we use is experienced. We don't take new graduates. Also, the health clinic is involved through the process of selecting the locum with us.
We initially went on the website and had a look, but I guess I'm old school and I do prefer talking to somebody, you know, a voice to a voice, and so utilised the website, but then jumped on the phone and spoke to a representative there, and it was just so easy.
One of the unique things about NAHRLS is that the only payments that you need to make are the casual hourly rates for the
It sounded too good to be true, that all I needed to do was to pay a wage for the staff member, so even if it had been that one of the other girls was available, I'd still be paying that wage. So financially I couldn't see any loss to the clinic at all, and that there were no other hidden costs associated with it. There were no fees or finder's fees or anything like that.
We don't force a locum onto anybody. If there's no fit, we don't go ahead with the placement. We also cover all the insurance for our locums, so there's no out-of-pocket expenses for the health clinics for the insurance and workers' compensation. We also pay the salary of the locum up front, and then charge on invoice after the placement has happened. If there's any problem with the accommodation or any problem with the travel, we're the point of contact for our locum to sort it out.
Following on from once we'd actually had our locum come through and providing the feedback back to NAHRLS, I also had an opportunity to speak to some of the other practice managers and clinics in the environment and let them know how easy I thought it was to be able to get the locum, because I knew that some of them have similar concerns to me. They're a bit more remote. They don't have the opportunity to have extra nurses sitting there. So I did promote NAHRLS from that perspective, that it was easy, professional, and I had a very good staff member or a very good locum while they were here. Yes, I'd certainly utilise them again.
Okay, no, that sounds really good. I'm Kathy Davey. I'm actually a Tassie girl, born and bred there, and lived a few years in England. My dad was a dentist, so we were over there for 5 years in the 60s, and then back to Tasmania again. After I'd done my nursing, I moved to Sydney and lived there for about 5 years, and currently I've lived 24 years in Canberra since my eldest was 6 months old. I'm a registered nurse and I've been doing that since I think I graduated in 1978, so I'm in the old cohort now, ready to retire one day. So after I'd done my general and my medi and my theatre, I basically joined the Navy and worked as a theatre sister there, and that was kind of on and off for a while. And then I left the Navy after a short service commission, which you could do 2 years, and then I went to work at St Vincent's Private with Dr Victor Chang, which was a very special time in my life. And then I decided I liked the Navy, so I joined back up again and worked there for a few more years. Then moved to Canberra and had various jobs in operating theatre, and then about 13 years ago now I became a practice nurse down at Isabella Plains and Cornwall Medical Centre, doing immunisations and babies and wounds, etc. like that. And last year I moved to Queanbeyan Hospital here, doing kind of the same thing. Queanbeyan Hospital here, I'm called what's a generalist nurse, so I do the immunisations and home visits, doing wound care in people's homes. I also do a day of cardiac rehab. We have a rehab session here. Before I get up there, that'd be really good. I've done some placements with Remote Area Health Corps, or abbreviated RAC. For me, the NAHRLS application actually wasn't that difficult. So my first placement with NAHRLS was Kununurra at a GP practice there. There were just two doctors there, and it's a little practice office at the hospital. And then the other one I've done placement was to Ayr Hospital up in the Burdekin area, and that was 2 weeks as a child and family nurse working there, doing the immunisations and baby health checks. I do get a bit nervous about going to places because some of the jobs are a little bit different than what I'd normally do, and so it's good though. It gives you a bit of an adrenaline rush to make sure that you've got it all right, and I usually research where I'm going first. I'll research the area. Primarily I'm there to work, but I'm not one to just sit in the hotel room or sit in the apartment without looking around. And when I was in Kununurra, I was actually there with my partner, and we had a weekend. The week kind of spread from a Tuesday to a Tuesday, so I had a weekend there. So we took a fishing tour down the Ord River and caught some barramundi and looked at the huge crocodiles there. And the second day, I think on the Sunday, we took a Triple J tour on Lake Argyle. Awesome place. Biggest water storage, I think, in Australia, and filled with 25,000 crocodiles, which and you can have a swim with them. And there's a picture of me somewhere with a noodle, sipping a glass of champagne. So you make the most of when you're there. I think Kununurra, we stayed in the caravan park, got a very posh cabin on the waterfront there. And that was excellent. Without a car, that made it a little bit difficult at that placement, but the nurse was very nice, and she actually lent us her car because it was more than walking distance into town there. And she actually lent my partner a boat too, so he could go fishing. So that doesn't happen at everyone, but that was really good.
And also, one of the great things that NAHRLS does do is we do cover, we do offer incentives which cover a meal allowance and just an inconvenience for having to travel out to these rural and remote areas.
Look, I'd do more of them. I'm just a bit chicken to actually give up a full-time job to go and do remote, but I would love to do a lot more than I do. I think I've done 2 weeks this year, but I'd probably like to do a few months of it, in actual fact, going to different places. And I've tried to get some of my other nursing friends to do it as well. And because it is short-term, it makes it much more manageable. It's for other people. Obviously you're going and you're helping other people, but it's quite good doing something for yourself as well, to go and learn and grow as a person by going on these placements, and to know that you can manage by yourself in areas where you don't normally work, and being by yourself as well in strange towns, and knowing that that's all safe and good, and people look after you when you're doing that. Yeah, no, it's awesome.
Just using an example, I was at a conference in Melbourne for optometrists, and actually one of the optometrists was there because he got NAHRLS backfill. He actually came up to us and said he would not be there if it wasn't for NAHRLS. And the other good bit about it is he was able to actually take his wife and children away with him to come down here and turn it into a little bit of a holiday, which he also had said that he has not had an opportunity to do that with his wife and children for a number of years. Okay, excellent. Okay, thanks, Michaela. Seeing something like that, actually, you realise that you are doing more than just providing a locum. You're actually assisting with people having a life outside of their practice, which then makes going back to their practice easier, they're better, they can work a lot better in those communities.